Members of the Fédération des syndicats des employés de la santé, pharmacie et assimilés and their partners, Public Service International, have been on the ground in the northwest and southwest regions, sensitizing the population on the need to secure their health workers.
Le conflit qui se déroule au Nozo en ce moment est un conflit qui est très rude.
The conflict that is going on in the northwest and southwest regions is a very rude conflict. Health workers are those who suffer most. They are caught in between secessionists and the Cameroonian military. When they treat the military, they are kidnapped and tortured. When they treat separatists, they are arrested.
De même, lorsqu'ils le font pour les secessionnistes, on les accuse de complicité. Et les conditions de travail n'est pas bien.
Several workshops have been organized by the association to equip the health workers with techniques on how to carry out their duties in times like this.
La Fédération des syndicats des employés du personnel de la santé et pharmacie du Cameroun, avec l'appui
The Health Workers Syndicate, with the help of Public Service International, thought it wise to help guide our comrades in these zones. The best way was to train them on social dialogue, which is very important in crisis zones. We also needed to train them on the techniques of negotiating.
Dans des zones qui sont en crise, et également la négociation, il fallait les former sur les techniques de négociation.
During the seminars, new methods were arrived at to help keep them safe.
Nous nous sommes déplacés à Limbe, à Kumba, à Buya.
We have gone to Limbe, Kumba, Boya to talk and sensitize quarterheads. We visited churches to talk with the population to seek peace. These talks are bearing fruit. We have found a temporary solution with the health workers in this zone. They now wear their blues. These ways, whoever sees them like that will not harm them.
Lorsqu'on voit les gens en blouse, on les laisse passer. Avant, ce n'était pas le cas.
The move made by the association and their partners falls in line with their desire to bring the syndicate close to health workers.
Notre mission principale consiste à encadrer nos camarades.
Our main mission is to guide these our comrades of the health sector there in the northwest and southwest regions, because they are victims of so many actions, killings, kidnappings, and many others. Our first objective as a syndicate is to be close to the health workers. We have to give them all our support so that they will not be disturbed in their functions and that the threat should cease.
Not only are they taking the syndicate close to the population, they are also taking their worries to the local authorities. Meetings have been held in Yaoundé between members of the association and members of the Cameroonian parliament.
Personne ne peut rester vraiment insensible parce que vous venez de porter comme de bien son pays. C'est-à-dire n'est pas une chose. Au regard de ce que nous faisons,
with regard to what we do, we are getting to a higher level. We want to meet with elected officials. We have been meeting elite. We have done a lot of lobbying, and we see that things are not as they were before. Many things have changed.
The actions they have taken are already bearing fruits.
This is gradually returning. Our workers are gradually, after the meeting that we got with them, the educational seminars, they are becoming more and more safer, and they are becoming more and more protected. I think, except just for the reason that that's on the 11th of February that we got another situation in Cameroon where more than 50 students got injured, and according to the communique from the Northwest region, 1 or 2 dead as a result of an explosion that occurred on the grandstand where the people and students were marching. That's on the 11th of February. I think a part of that, which is the most recent, peace is gradually returning, and we pray that with the effort, the educational seminars and more meetings that we'll continue to have with the elected authorities, peace will gradually return. Our workers of the public sector will gradually gain more protection.
We noticed a relatively calm atmosphere within the population that we met. Secondly, we also noticed that health facilities that were destroyed were being rehabilitated, and also that all kinds of victims were being taken care of. The third is that there was a better understanding of the role of a medical worker in warring times.
Nous souhaitons vraiment que le gouvernement.
We wish that the government take interest in this situation and do something fast, because it helps workers that are suffering. They want to treat people, but they are killed. Their family members died, and no one seems to care.
Familles meurent, leurs enfants meurent, et personne ne vient à leur secours.
The communities that are benefiting from their work say it is a stitch in time.
I found it necessary and normal. I even appreciate the approach you use to inform. You bring people to participate. I took part on one workshop through a man who present me.
The local population has been challenged by the syndicate to be advocates for the safety of their health workers. Appeals have also been made to the government to find lasting solutions so as to put the crisis to bed eternally.